Colorectal cancer is one of the most common cancers in the U.S. The good news is early detection can save lives. Today we are breaking down the warning signs, the risks, and the screenings that might make the biggest difference with Dr. Sarah Worden from Optum Care in Washington, or Optum Care Washington, excuse me. Thank you so much for being here with us today.
Thank you so much for having me to discuss this really important issue.
And I know March is Colorectal Cancer Awareness Month, so what better time or what better way to end the month? For people at home, maybe tell them what exactly is colorectal cancer.
Colorectal cancer is the third most common cancer in the United States. It's a cancer of the colon and rectum, which is also called the large intestine. Very common cancer. If caught early, people can have a very long life.
And so I guess, so that's why we always hear the words early detection is key. What are some of the warning signs that people should be watching out for?
That's a good question. People with early colorectal cancer may not have any symptoms at all. If you do have symptoms, they may be things like change in your bowel habits, new constipation or diarrhea, sometimes abdominal pain, or noticing some blood in the stool.
And we have some of those warning signs here on the screen for you to read and think about if you aren't or are experiencing some of those things. And with a lot of cancers, certain groups are more at risk. What have studies or research shown about colorectal cancer?
Yeah. Cancers do increase as we get older. Also things like being overweight or obese, smoking, alcoholism, or just drinking alcohol, not having a very active lifestyle, diets that are high in fats, poor nutrition, are all things that can put people at risk.
And for some people, especially when you think about some of the screenings for cancer, that's what makes them nervous.
Yes.
And they're kind of like, I can put it off. What is the screening like, and when should people get it?
We recommend starting screening at the age of 45, again, even if you don't have any problems, because that's when we start to see the increase in cancers. And so 45 colonoscopy is the best test that we have. If people seem uncomfortable with it, there are some other screening devices that check the stool for abnormalities as well.
And what are some of those other screenings like? Because, when you think about colonoscopies, people are always dreading the prep. I hear a lot of people talk about and things like that. The other ones you were talking about, is it I guess it's as much preparation needed to get those done.
Well, there are a handful of different types, and some of them require a small amount of a bowel movement, some require an entire bowel movement. Basically, they're looking for blood or some DNA abnormalities that may put you at risk. To kind of give a shout out to colonoscopies, it is a way of actually taking out polyps, which is what causes colon cancer, which may not be picked up in the stool studies, which are not as effective for screening. I
have a friend who, she just turned 30, but her father died from colon cancer, so she had to get a colonoscopy earlier, and she said it wasn't bad. She said people, you see all these little fear-mongering videos, but she was like, when I went there, it actually was not, it was an easy process.
I would agree. It's pretty quick. The worst part is the bowel prep that you do the day before, but the procedure itself, you get sedation. It takes about 15-20 minutes.
And we started this conversation off just talking about how early detection can save lives. How does the survival rate change when someone finds out early that they are dealing with colorectal cancer?
Yes. Screening is great because, again, typically early stage cancers have no symptoms, so we can potentially catch cancers early when they're fairly curable. So early stage cancers have about a 90% or greater 5-year survival rate.
And one last thing, because I've been seeing a lot of articles about how young people are starting to get this cancer early. What research have you all been seeing, or what do you think is leading to this?
Yeah, there's a lot of research going on. Our guidelines used to be a little older for colonoscopies. Now they're 45, and it is because we're seeing people younger and younger getting it. A lot of that we think is related to diet, lack of exercise, the environment, just the foods that we eat. So we like to encourage healthy food choices, being active, avoiding smoking, drinking, just trying to lead as a healthy lifestyle as you can.
Thank you so much, Dr. Warden, for coming here and sharing your wisdom and hopefully encouraging someone who might have been a little afraid to get that screening to go out and, save lives, essentially.
Agreed. Thank you so much.
Thank you. Well, for more information about your Optum care options here in Washington, head to the website on your screen.
New Day Northwest is sponsored by Optum.